Hey, if you've clicked on this video, that's because your neck is hurting and you need to get past that. So what I've done is I had an old set of exercises that uses tubing. It uses like exercise bands, but I realized that a lot of patients, a lot of people out there may not have the bands. So I'm trying to do a similar set of exercises, and I've added some that I really love with some mobilizations that you'll see here. And it doesn't take any equipment at all, really. I mean, you need a pillow, but who doesn't have a pillow? Or just some sort of cushion or something you can push your head against. So that's basically what we've done. We're doing the same method as we always do with most of our rehab: mobilize, stabilize, stretch. We're going to follow that same pattern. And also never forget rule number 1, which is no pain. So if something hurts, back off, modify, or discontinue. Okay, so that's going to be the rules moving forward. This is a really good exercise for any neck pain that you've got, specifically in the neck. A lot of the neck pain that goes down into like your shoulder blade area. So if that's what you're suffering with, you're in the right place. And just repeat, repeat, repeat. Do it every day. You can do it 2 to 3 times a day as long as you don't break rule number 1, no pain. So here we go. Go get it done. Okay, so here we go. We're going to start with our exercises. I'm going to swipe here. We're going to start with our mobilization. Now, this is one that I absolutely love. So what you're going to do, you're going to find the pain points. And this is one, if you ever feel that twinge where you're like, oh no, I'm in trouble. You're going to find the pain, press on it. You're going to do 10 mobilizations into all the God-given ranges of motion, flexion and extension. Okay, so we're going to go forward and back. Notice I'm pushing. Then you mimic it on the other side. We're going to do flexion and extension 10. Then notice I'm going to turn. We're going to do lateral flexion. So you're going to go tick-tock back and forth while you're pressing. Oftentimes this is a facet syndrome or facet problem. That's an encapsulated joint. You're pushing on that capsule, trying to bubble it open while you go through your ranges of motion. Now we're going to switch to 10 rotation, left and right. And you're just going to go through 10 of these mobilizations in all of those directions. Now, so sometimes I'll feel the twinge, I'm doing a pull-up or a press, or you turn your head wrong and you feel that twinge. If you've experienced that, you're like, oh no, here it goes. You're going to push and go through all those ranges of motion. Find the range of motion. Usually for me, it's like flexion and extension, and you're going to clear that, okay? So it doesn't work 100% of the time, but oftentimes you can turn a 2 or 3 week problem into a 2 or 3 day problem if you can do that. So this is an awesome mobilization, okay? Then we're going to move into our exercises. Now you could modify these a little bit. I like this order that we've done, but I'll kind of explain some of the modifications. So you're going to take a chair. You're going to put it up against a wall. You can do this in your car too. That's what I love about this one, because you can use your headrest. And all that we're going to do is we're going to do our flexion and extension. You're pushing back against the cushion. This is rehab. So as far as my effort level goes, we're like a 1, 2, or a 3, okay? Then you're going to rotate the head and you're pressing back again. So we're in rotation, but you're pressing back. Same thing, 2 or 3 out of 10 on the effort level. You're going to do 10 in each direction. Now notice we turn. We're going to go the other direction. Make sure it doesn't hurt. 10 with the rotation and extension. Okay, we're still going. Now we're going to repeat this. We're going to go all 3 of those directions again. 10 presses, okay, while you're just pushing back against the pillow. No hold on this yet. We're going to get to a hold, and that's why I said you can modify some of these. Now we're going to do our rotation, 10 more. Okay, we're going to go through 3 rounds of this with 10 in each of those 3 directions for right now. Now I'm turning my head, going to go the other direction, and should be pain-free, should be nice and easy. Don't push it. Like, take what your neck is giving you. If you can only do a little bit of rotation, take what you can get, and then do your light presses. And now we're in our last extension. Now with this one, you can also, we went through the mobilizations, you can push onto the sore spot or down into the shoulder. Sometimes if you push, you'll be able to get a little more range of motion, especially if you're feeling pain. But for the most part, this should be easy, pain-free, nice, easy ranges of motion. Make sure you're not overdoing it. This is our last with rotation. Then we're going to do our holds. So notice we're on our extensions with the head turned, and now, there we go. We're going to go into our holds. So I'm going to push back and hold. 1, 2, 3. We're going to hold this. I think I hold this like 10 to 15 seconds. Okay. And now we're going to turn, push back again, 10 to 15 seconds. Okay. With just nice, easy pressure while you're holding. And then turn and press back again. Now, the modification that you can do if you want to do this after each round, so say you do 10 extension, you can finish with a hold as well. That's the other option that I'll oftentimes do the hold at the end of each time. So then you're going to end up doing, if you do 3 rounds, you're doing 3 holds. Okay? Now, we're going to go into flexion. So with this one, you're going to push the chair out. This one looks like you're in timeout. I call this the timeout exercises. So your head is going to be against a cushion, okay? And you're just going to be pressing into flexion. So notice I'm pressing. Hard to see exactly what we're doing, but just pressing. There we go. I'll slide the pillow up and down. You just want to be able to go into that flexion with light pressure. Again, we're going to do 10 here. After I do the 10, there's our 10. Then I take a little break, do some mobilizations, do some press, like we're going to go through the same mobilization that we did before while you're pushing. Okay, now we're going to put the pillow back up. We're going to do 3 rounds here with just nice, easy presses. Again, should be the 2 to 3 out of 10 on the effort level. You can either slide the pillow or just press into it, but it needs to feel good. So we're just kind of contracting those muscles lightly as we go through these ranges of motion. You can hold the pillow, or you can see I drop my hands down. You don't have to hold it, but it should be easy. And we're just going to do our mobilizations. You just want to take a short break in between each one. You know, give your body time to kind of reset. Everything should be nice and smooth and easy. Light effort, nothing too much. Now we're going to go into our 3rd round of our flexion. Our 10. Now notice we're going to do the same thing. We're going to do the hold. So I'm going through my presses. Obviously it's hard to see how much pressing, but nice, easy presses here. And there's our hold. Okay? And we're doing 10 to 15 seconds again. Okay. I think what I was showing there too, I switched. I went from the hold at the end. So you can do any of those modifications. You can do 10 separate presses, okay, with a hold at the end, or you can do 10 separate presses with the mobilization. So in that one, we were showing a little press at the end, so 10 quick mobilizations with a 10-second press in between each one. Now we're going to move on to our stretching, okay? So we do mobilize, stabilize, stretch. Now with this one, I'm saying you're getting down into the shoulder. You're going to bring one arm across, okay? I'm hugging the shoulder, and we're going to do kind of a mobilization / stretch. So I know we do mobilize, stabilize, stretch. This one is a stretch and a mobilization. Now I'm pulling the shoulder away and tipping. Notice I tip the head because you want to stretch into the neck. This one stretches that whole shoulder girdle. We're switching sides. We're doing 10 little rotations with the shoulder. This one should be really comfortable. You're mobilizing and stretching that shoulder, the whole shoulder girdle. The neck and the shoulder are so intimately tied. So we just went through 10 quick little rotations. When we're doing it with tubing, this is one where you lean back and let the tubing kind of give that stretch. So now you're just doing it one shoulder at a time while you're mobilizing and stretching at the same time. Okay? So it should be easy. It should be a nice, easy stretch. You should fill it into the shoulder and the neck as you tip. And now we're going to go into our last stretch. This one's called McKenzie neck exercise. Now, I like adding the McKenzie. They don't add the arms. What I like doing is creating a little shelf, because if you do this one, we're just going to do a hold. Notice we just tip, hold for 2 or 3 seconds. You can hold a little longer if you'd like, 5 or 6 seconds, but in here we're just holding 2 or 3 seconds in each one. This is pure lateral bending. When I say pure lateral bending, if you want to look in a mirror, pretend that your head is a board with a nail going down your nose. so it pivots on your nose. You want your nose to stay in the center. I like adding my hands so that I can kind of relax, give a light push, but really you want to use your hands as that shelf so that you can keep that pure lateral bending with your nose right in the middle. Okay? That's it. So those are our stretches. The end stretches are a little more like a mobilization, but depending on how long you want to hold those, again, if you're doing like the McKenzie, if you hold that a little bit longer, it's going to turn more into a stretch. So with that one, there's lots of variations, like whether you're going to hold, whether you're going to do the 3 sets of 10 with the hold or do a hold at the end, and then also how long you're going to hold the stretches. You decide what's feeling the best for you. Listen to your body, take what it's giving you, and don't ever push into pain. If you do that, you're going to turn your pain into power, your weaknesses into strengths. You just want to do this every day, especially if you're experiencing pain. If you do that, you're going to push past this and you'll get past that neck pain. Okay? So go out and get it done. Be regular with it. Comment if you have any questions. See you guys.